Sir, we are live now.
Good evening, friends, and welcome to this very important show on Mirror Wisdom Reflected. And as you know, Mirror Wisdom Reflected is a show wherein I, as the host, act as a mirror and reflect the wisdom from some of our great speakers who have a lot of knowledge and understanding about their subject. We have had quite a few dignitaries. We have had a lot of interaction with people, doctors, with celebrities from various fields. But at a time like this, when Omicron is striking so heavily and the tsunami is right there, it's hitting us in a big way. Let's try and find out where do we stand, how good we are we going to get worse, how safe are we, what's happening, where are we, and where are we headed? To discuss these questions, I have a very dear friend of mine, Dr. Rahul Pandit. He's the Director of Intensive Care at Fortis Hospital, Mumbai. He's a visiting consultant at ICU, Bathurst Hospital and Wagga Wagga Hospital, Australia. He practices there for a month in a year. Member of the National Task Force, Supreme Court appointed. And he's a member of the Maharashtra Government Task Force for COVID-19. He's a teacher for the College of Intensive Care Medicine, Australia and ISCCM Fellowship and Diploma courses. And he has several original publications. He's an MD in Anesthesia and a prestigious fellowship of the Australian College of Intensive Care Medicine. There are a lot of accolades that I can keep talking about Rahul. But let me tell you, friends, he's the man in action. He's the ICU guy. You know, he's the man who's been wearing the COVID protocol. He's been wearing his mask. He's been going into the ICU and saving patients left, right, and center. And he's been doing that right from day one when COVID started. The government at the central level and the Maharashtra government found it imperative to take advice from what he has to say from his huge experience on this subject and how to deal with it. There has been a sea change. And you know what a sea change it was. Where steroids were contraindicated, ventilators were to be used. You didn't know what to do. When COVID started, nobody knew how your enemy was, what your enemy was, how we're going to do and what we are going to do. We are always at a loss because we never knew what is coming. But modern medicine, being the way it is, it learned from its mistakes. It never stayed put. There may be criticism that at once upon a time, ivermectin was good. Once upon a time, remdesivir was good. Well, at every point, there was progress. People were ready to understand, accept mistakes, go back on their own understanding, learn from what was happening. Result, patient benefited, mankind benefited. Vaccines, a great surge in human history. People thought it was a very fast, and how could it be approved when it used to take 10 years? But when the President of the United States opens his purse and the best of the brains in the world get together, they come out with something unique. Because if we don't, then we should be like dinosaurs. We shouldn't be existing. And that is the faith and the leap of faith we have in mankind and the modern medicine that we have. Friends, we have had the first wave, the second wave, which was there. And you saw how in the last 3-4 months, London and UK had 30, 40, 50,000 cases every day. Every day, the scenes that you see in the US hospitals, cases increasing, highest number of cases ever from the time COVID started. Not even in April, May of 2020 that we had so many cases. That is the kind of number of cases that we have been facing in the world. And the surge has been humongous. Delta has been forgotten. And its elder brother, younger brother, Omicron has come. Just as the English alphabet has 26 letters, we don't know where we stand in this game against COVID. This time it's Omicron. The virus is smart, nature is smart. And most important, survival. The virus is very smart. If it knows very well that if it kills you, it will not survive. So it undergoes various transformation. It wants to live and let live with a symbiotic relationship, like the good old flu and the other viruses that we have had in the past. So also this time we had Omicron, a friendly virus, giving you the original vaccine. And that's where we stand. Dr. Rahul, welcome to the show and thank you for sparing your valuable time from your ICU and a very busy schedule that you have right now. Rahul, tell us, how is the scenario of Omicron going on right now in Mumbai, Maharashtra and India?
Good evening, Dr. Mehta. It is indeed an honor and a pleasure to be here on your show. And I must say that the good work which you're doing of propagating knowledge across to people and shows like us, where we are actually talking probably to common people more, actually help us in disseminating knowledge to the right people at the right time, in the right way. So where are we? What is this Omicron doing? So the Omicron is essentially one of the fastest multiplying and transmissible virus known to the mankind, coming as close to the measles virus as it can. Previously we used to say that nothing comes closer to the measles virus. This is now as close to the measles virus as it can be in terms of its transmissibility, and that is why we are worried as a whole world that how rapidly it has spread across in at least 5 or 6 nations before it hit India. And the story in India is exactly the same. We have seen 550-fold rise in the cases in Mumbai and in Delhi. Delhi specifically, 554 cases of rise is seen. Delhi was below 50 cases, and now suddenly Delhi is ahead of Mumbai. Mumbai was hovering around 200 to 300 cases in the mid of December, and now we are peaking at around 21,000 and hovering at that number, though the number in the last 2 days have come down a little bit. But the fact is, as we discussed just before the start of the show, that people have now become more cognizant of the fact that you can actually do a test at home, and they are doing tests at home. How many of them are actually truthfully reporting it on the app, which is meant to be done, is a big question mark. And I don't want to be criticizing people, because I don't want to be actually saying that you don't do it. It's the right way to do. I think they can be even more right by reporting it, but they're at least testing it, which was one of the biggest problems in the Delta wave, that people were not testing, and then only when they were deteriorating they were coming to the hospital with very low oxygen levels, and we used to call that as happy hypoxia. This time around, though, hypoxia is not seen, which is thankfully good. People are self-testing, and they're at least isolating. So they are protecting their loved one, they're protecting their community or the building, the society, the place where they stay, and they're protecting their workplace by not actually going and reporting to the work. So that is very, very welcome change which we have seen. I think if people have learned something, that's what they have learned. Next thing now they need to learn is to report it to the authorities, which is going to be a tough task. I don't know how people will learn about that. I think we are in the rise of the cases right now. Our country is like many small countries. South Africa is size of Karnataka in terms of population. UK we know is somewhere between Karnataka and Maharashtra in terms of population. So we are each state is like a country. Some cities are like country within themselves, and each place will have a cluster which will go up, will peak, and then come down. Over the next 2 months, we will see that the entire country peaks up and gradually starts to come down as well. We will not see a wave which was like Delta wave, where it continued for 3 long months with very significant hospitalization. What will happen is that, thankfully, if every place does not peak together and it peaks sort of in a different way, the healthcare infrastructure will also get a breathing space, and we will be able to cater to people across in the whole country. So that's where we are. We are looking at an upward swing right now. We are not at the top currently, and we need to still wait for a few weeks before we can say that the hospitalizations are going to increase or not. I will tell you something about my hospital and my ICU right now.
This is
So
Fortis,
the
Fortis Hospital that you're talking
Fortis
about.
Hospital, correct. I'm talking about Fortis Hospital Mulund, which we were having around almost 170 beds in the last wave. And out of those 170 patients, 160 patients, we would have 95% of the patients on oxygen all the time. There were only 4 or 5% who were getting better, who were ready to go out, who had come off oxygen, who would be off oxygen. Otherwise, 95% would be on oxygen. Now, if I look at my ICU, I've got 2 on ventilator requiring oxygen, high oxygen. Rest of the patients are actually complex medical patients. It's like managing a complex medical ICU. So I've got patients who had stroke but got COVID positive, detected COVID positive on admission, who are admitted with me. I've got acute coronary syndrome. I've got 2 pregnant ladies who have severe pregnancy-induced hypertension, who we are managing. I've got a liver trauma, a young boy who came off the motorcycle, injured his liver. and he's in the ICU right now because he tested COVID positive and reporting to emergency. So what I'm seeing is that there's such a high test positivity rate that incidental COVID is very high, not respiratory COVID. Incidental COVID is very high. The COVID seems to be confined below the neck, above the neck, not below the neck at all. So it's in the nose and in the throat. It's not in the lungs, which is very good, I must say, which is very good. And as long as it doesn't bother the other organs of the body in terms of thrombosis or in terms of end organ dysfunction, I think it's okay. This test positivity rate might be high. It will come down eventually.
So my question to you, Rahul, is that, yes, as you said rightly, and I still feel that the so-called thing that we see in the news today, that we have plateaued and all, I guess more people have become smarter and they're doing antigen testing. And I know quite a few people who are not even doing antigen testing. They know that it's there. Nobody wants to report to the government authorities because they are scared that they might be confined and they'll have to keep reporting. That's the unfortunate part of the story. But one more trend which I see even in educated class and good people, they have started moving around, going around because, within a day or 2-3 days, they've started feeling good. And I know people who have gone for a wedding despite being positive. I mean, in a sense, within 3 or 4 days. So what is the ideal time that you might say that once you get detected antigen positive? Okay, first of all, for the sake of the crowd, if you are antigen positive, is it 100% sure shot that you're positive?
Yes.
Correct.
If you're antigen positive, you are 100% positive. There is nothing called as false positive in antigen.
Correct.
You do not need to repeat a RT-PCR.
Correct.
And, not for the sake of testing, for the sake of confirmation, you don't need to repeat.
Because I have friends who are antigen positive. They did RT-PCR. They were RT-PCR negative because RT-PCR is also 30% at the time not positive.
Correct. So, and it also picks up virus into a different way. It's got a cycle threshold, whereas antigen has got a different way of measuring it. So if antigen is positive, please don't go and repeat RT-PCR. If RT-PCR comes positive, fine. But if it comes negative, don't say that I am negative. That's absolutely wrong thought process.
Very important message for the listeners here, that do your antigen back at home, be safe for yourself and your family. If one member is positive, take it for granted the others are also positive. Get your antigen tested. You don't have to do an RT-PCR. Rahul is very clear about that. Thanks, Rahul, for clearing out a very important doubt, because people are still not very sure and they want to do it for double checking whether RT-PCR is there. And so you don't need to do an RT-PCR. Okay, once you're antigen positive, what is the confinement period? Is it 7 days, 10 days, 15 days, 5 days?
Okay. So,
sorry.
Yeah, so it's very clear again. It's not very difficult. Sorry, my internet connection is playing up. My voice might be breaking up in between. If required, I'll change on to a dongle. Usually it's not too bad. So it's very, very, very easy. Let's have it a very clear understanding. People who have asymptomatic disease or mild disease, they have to remain confined in the house for 7 days. If they're asymptomatic for the last 2 days before the 7th day is complete, they can be de-isolating themselves. So there is a difference between quarantine and isolation. People need to remember that. First, let's clear that doubt. What is quarantine? What is isolation? Quarantine is that I came into contact with somebody and I'm not sure that I am positive or not. I'm quarantining myself. Isolation is I am positive, I've exposed, I've tested positive, I'm going to isolate myself for 7 days. So that's the clear definition of the two. And isolation after 7 days can come out if there are no symptoms for last 48 hours. If you remain symptomatic and at day 7 also you are symptomatic, you need to stay in the isolation for 10 days at least. After 10 days, you can come out of the isolation, no problems. You don't need to repeat a test as per the ICMR guidelines currently, as per the WHO guidelines currently. You don't need to repeat the test. 5th day is also there. 5 days isolation, quarantine is also there. It's called as quarantine. So let's say I am staying in my house and one member of the family is positive. And of course, when you're staying in the house, you are exposed to each other because you eat, drink, sleep, talk all together. So you then quarantine yourself. So for 5 days you wait, because the half-life of the virus or the replicating or the incubation period of the virus is around 2 to 4 days now for Omicron. So on 5th day, if you still don't have any symptoms, test yourself. And then if you're negative, you come out of the quarantine period. That's the one. But for the severe disease and moderate disease who require ICU, who require to be on high flow oxygen, the quarantine, the isolation period is still 14 days. It has not changed. It has only changed for people who have mild disease or asymptomatic disease, and for people who are exposed and quarantined and are not having any symptoms. So if you are having admission in the hospital where you require oxygen, you're still required to be quarantined or isolated for 14 days.
Yeah, thanks, Rahul. That was very important, friends. So that he said very rightly, 7 days minimum or 10 days, and at least 2 days being asymptomatic. That will help your family, most important, your close loved ones. And there's no hurry to go to the office. Work from home has become a great criteria. You don't have to and miss out anything else. And since it's a mild one, it's, now, Rahul, the question is, it is mild. Everybody thinks it's just like another virus and a small flu. Where is it getting major? Do we have any chances that we are going to get major? And as you said rightly, that there are very few admissions, and with comorbid, a stroke patient or a cardiac patient, incidentally turns out to be positive, are the ones who are there. But primarily, otherwise normal people are not rushing for oxygen or ICU beds. Am I right?
You're right. As of today in Mumbai, the ICU beds are fairly empty. I'm talking about the entire Mumbai. Some of the top private hospitals like ours, your Leelavati and maybe Ambani, they might be full because that's where people flock generally first. But that's not the reflection of what is happening across the city. Across the city, more than 70% beds are still empty. They're not occupied. What we need to understand is that while we may say it is all mild, remember there will be still a percentage of patients, small percentage of patients, who would still require oxygen. And when we are seeing cases in 20, 30,000 per day in one city, a lakh plus cases across the country per day, we may then say that even if 1% require to be admitted in the hospital for oxygen, it will still be a very high number. If you're going to say 1,000 patients requiring oxygen per day will be admitted, in 10 days' time, you will have 10,000 people who will require oxygen in the city. So we need to be very clear that a small number of a big number is still a big number. That's the mathematics which we have to understand.
That's right. See,
when it accumulates over 7 days, then the healthcare infrastructure gets stretched. Sorry, you were saying something.
No. So I appreciate, that's what I was trying to tell, friends, that the way it's growing and the way it's spreading fast to almost anybody and everybody. Suddenly, if you have 10 million people are getting affected, you have 25 crore people getting affected in the next 15, 20 days. That could be a big catastrophe because you never know how many will need admission, as Rahul said so rightly. A 1% in a 200,000 is a different, and a 1% in 2 million is different. So this is a very important story, and so don't take it lightly. We don't know how is it going to fan out. The next 7 to 10, 15 days are going to be very vital for us to understand how Omicron behaves in India. Am I right, Rahul?
Absolutely, you're absolutely correct. How it behaves, how many admissions it gives rise to, how many lower respiratory tract infections we are going to have, how many other end organ damages like strokes and heart attacks and clots, which we talked about in the first few waves, but it was obviously lungs overtook everything else. So we just don't know that. And I might just touch upon that. It's very often forgotten. Is it going to give us a gift of a long COVID? I still have patients from first wave who tell me that the sleep pattern is still not normal. First wave, 2020. Okay, I will give you my example. Because we were one of the first ICUs to start off, I had COVID in the month of May 2020. It wasn't until December 2020 that I could sleep normally again. And it was almost 6 months of not feeling normal when I was sleeping. And what was that? I just don't have any explanation for it. It was just the sleep would be fragmented, it would be broken, I would wake up for no reason. And now it's fine, but it took 6 months. It was until December that it started getting normal. So this is just one tip of the iceberg problem. There are so many of them. We were the first to start the post-COVID OPD in the city of Mumbai. And I used to get patients from all across Mumbai. And if you look at their symptoms, they were genuine symptoms which were just unexplained. I had one of my own doctors who would look at the monitor, stare at the monitor, and would not be able to decipher numbers. A complete brain fog. So many patients had brain fog. So many computer engineers came and said to me that they cannot concentrate on the computer for more than 10 minutes. That's their livelihood. So I think this long COVID is often not understood and not described well, and people sort of tend to forget because they just concentrate on the acute illness, and then when they come out of it, they don't realize that what's bothering them is still because of COVID-19.
Correct. So very important point that, friends, you should not take this lightly. This may be light like any flu, but the long COVID symptoms, with a lot of people who are coming to the COVID ICUs and the COVID rehabilitation centers, there are various kinds of things. I have a person whom I know, a patient whose sugar went out of control totally, no insulin working. Same patient was fairly under control. After COVID, nothing works. His sugar has just gone through the roof. Everything has gone haywire. And there is no answer to that. It was just COVID. What about the city value? Is there any consequence to the city value that you get in, when they do all these tests now?
Okay, so I think again, CT value has suddenly become very important because people want to differentiate between Delta and Omicron. So CT means cycle threshold. Okay, so cycle threshold is going to be different for different machines for different labs. Let's understand that. If a same sample is taken from one person and sent to 5 different labs, you will have 5 different cycle thresholds, plus or minus 2-3 digits of each other. Okay, it does not depict severity of disease. It probably depicts viral load being very high, and that is one of the reasons why in Omicron we are getting antigen positive, because Omicron cycle threshold is generally believed to be low. Lower the cycle threshold, higher is the viral load. So the CT value between 10 and 20 is what we are getting for majority of the patients. And if it is between 10 and 20, the antigen is also coming positive because they have very high viral load at that time. Okay, it does not talk about severity of the illness. It just talks about viral load, infectivity. If the cycle threshold is above 20, it does not mean that you have then Delta, because it all depends on what phase of the illness you caught this person on. Because when the person starts getting better, the cycle threshold starts increasing. Once it reaches above 35, your RT-PCR is not able to measure. Once it goes about 25-30, your rapid antigen test becomes extremely unreliable because the sensitivity might drop down to as good as 20-30%. So a lot of patients who are in the phase of the illness where it's early, for first 5 to 7 days, the rat will be very sensitive, the cycle threshold will be very high. Another thing which CT value tells us is where in the whole scenario of pandemic are we? The CT values consistently are low. I think in a whole community, we can say that there's a rapid transmission happening. These are no books are going to say this. This is what just I have observed. As the CT values settle down, most people, you do see that the transmission is not happening that much.
On the same note, Rahul, now that you say you got antigen positive or you're an RT-PCR positive, good old days we used to do the D-dimer and we used to do the rest of the tests for the LFT, create and everything. Would you recommend any test to be done? What blood tests need to be done as
asymptomatic patient, completely asymptomatic, like somebody in the house was positive, because somebody in the house was positive, everybody else got tested, and somebody who had no suspicion, no symptoms, no signs is positive, you don't need to do any blood test for them. Please don't do any blood test for them. If you have symptoms, then it is probably important that you do at least CBC, CRP, and D-dimer on the 4th or 5th day of your illness. And then if they're abnormal, repeat them again by 7th or 9th day. That's what you need to do if you have symptoms. If you have comorbidities, then along with CBC, the CRP, and D-dimer, you need to do relevant investigations which might show up your comorbidities, how well controlled they are. So for a diabetic, it might be important to do an HbA1c and a fasting and a postparental blood glucose, because we know that sugars can take a hit. For somebody who has kidney disease, I always like to add a creatinine to understand what is happening. Somebody who is a heavily diabetic also, I would like to add a creatinine. But the attitude and the approach now is towards minimal investigations. No ferritin, no LDH, none of those things we do nowadays. The only simple 3 investigations which we rely on is CBC, CRP, D-dimer. I am finding that some of the asymptomatic patients also are having high D-dimer, but they're completely asymptomatic, so we don't do anything for them. And within the next 4 or 5 days, the D-dimer comes down, unlike what we were seeing before. Before, D-dimer used to take weeks together for it to normalize. Now we are seeing it come down very quickly, almost like an acute phase reactant.
So when you say symptomatic, in a simple, is it like a running nose? They get pain at the back of the throat, a little cough, cold. But more important, a lot of them are complaining of severe weakness and lower backache in the present scenario, what they are complaining of. So what is symptomatic?
So symptomatic usually means that you have a runny nose, stuffed nose. You probably have a low grade or a moderate fever, or you may have a cough. I think these are the most common symptoms. Body ache are probably very difficult to decipher symptoms. I think body ache, low backache, people have it all the time, but feeling of feverishness is there. That's going to be a symptom. Some patients are there who just don't have any symptoms, nothing, absolutely nothing. I do video calls, video consults for patients. Usually they are elderly family members who are consulted with me on the video. And then the rest of the younger members, they're all sitting in the room. They're all positive, but none of them have got any symptom because the grandmother or grandfather or old elderly dad tested positive. Everybody else got their test done, but all of them, the rest of them are fine. So I think in a family itself, we are saying 1 or 2 patients who may have symptoms. Most of them have no symptoms at all.
So somebody is asking again, repeat the test. CBC, ESR, CRP and?
CBC, not ESR, CBC, CRP, D-dimer. That's it.
Correct. And D-dimer. So
Yes,
CBC, CRP and D-dimer. I'll write it and send to you, friends. Don't worry. That is important.
The person is asking is saying, please repeat the test needed in asymptomatic or asymptomatic. No tests are needed in asymptomatic. Let me repeat myself. No tests are needed in asymptomatic. Only if you have symptoms, you do it, please.
With respect to that, what treatment do we advise now? Are you now coming to the newer drug, the molnupiravir and the newer drug which we have, anti-COVID? ICMR says a lot of side effects, and for pregnant people, you don't give it. But would you give it for others? Do you give any kind of antivirals, or we just cover them up with vitamin C and D and some amount of paracetamol?
Okay. So patients who are asymptomatic or who are mildly symptomatic. Mildly symptomatic means no fever, just a bit of cough, a bit of scratchy throat, maybe runny nose, or no symptoms. Absolutely nothing apart from paracetamol if they have body ache or fever. Nothing else. Absolutely. I don't even give vitamin C and vitamin D. I think we are overloaded with vitamin C, vitamin D, and all those stuff. We really don't need to have that unless you know that you're deficient in vitamin C, vitamin D. The next group of individuals is those who have fever and fever has not responded for 48 hours, or they have comorbidity, then fever has not responded for 48 hours, or the symptoms have worsened in 48 hours, or people who are elderly, 60 and above with 2 comorbidities and their fever is, they are having fever. I think these are the patients I might consider giving them antiviral drug, of which who would I definitely give? I would definitely give it to people who are elderly, above 50 or 60 years of age with 1 or 2 comorbidities, in whom fever has not responded with paracetamol for 48 hours. I would definitely give them molnupiravir. I would have no hesitation. People who are younger, who have got a significant comorbidity like transplant, like immunosuppressive therapy, renal treatment like dialysis going on, liver dysfunction, who we know has a very high risk of actually worsening, I would again use antiviral in them. Molnupiravir would be my drug of choice. I would definitely not give it to anybody below 18 years of age, pregnant and lactating women. And for a young couple, if I see that the couple wants to start a family, most couples don't want to start a family within 3 months of COVID. But I would then give them an advice that if you're taking molnupiravir because one of you needed to be taking it, then you should not conceive for the next 3 months. That's one of the advice I think upfront a doctor should give when you're using molnupiravir.
So you are fairly confident of molnupiravir as a molecule, that the new substance that we have discovered. And
I think it has got a reason. So what did we have before? We had favipiravir, and we have got molnupiravir. Okay. Yeah. Favipiravir has is a flu anti-flu medicine which was used in Japan, which was tested in 224 patients in a trial in Mumbai. And then it got its emergency use authorization, was used extensively in the second wave with a clear understanding that it has got a viral clearance. Okay. Now let's come to molnupiravir, again a flu-like drug. Again has got a very good viral clearance within 3 to 5 days, but has shown to have decrease in the hospitalization and morbidity and mortality in unvaccinated individuals. So if you have an unvaccinated individual, I think that the evidence is very good. Please go ahead and use it in the category which we just talked about. In a vaccinated individual, we have added comorbidities. So if there is somebody with comorbidities and he's vaccinated and they still have symptoms going on, you can use it. Again, whatever we know of these drugs is from the 3 or 4 trials which have been done in the last 18 to 20 months. Okay, no medicine is perfect. People took hydroxychloroquine like there was no tomorrow. We were giving it like lollipops in community for people to have. I remember the authorities actually distributing it. Then there was some arsenic album being given. So I think COVID has been a guru for me. It has taught us so many things. Apart from medicine, it taught many Indians to stay clean, to stand in a queue, to wait for their turn. Those things which we never used to do before. I think it has sort of taught a little bit of that discipline to us as well.
For hydroxychloroquine, President Trump had the audacity to call up the Prime Minister and say that I need it quickly and I need it
Yes.
now.
Yes.
He could push his muscle weight to India, the US muscle weight.
Yeah.
Now tell me, Rahul, what about the antibody cocktail? The Musk talked about antibody cocktail with President Trump took and maybe our Prime Minister Bojo took. So tell me about that. What would you? Are you in favor?
I think so. It's a very good therapy if we know that it's definitely a Delta variant or another variant, not Omicron. So if it's the Omicron, I think it's clear that it does not work. And the current wave being fueled by the Omicron variant, we should be clear that we should use your discretion in using this molecule. I have stopped giving it unless I see a clear S gene present in the RT-PCR, or I know that this patient has come with a lung involvement or loss of taste and smell. Because Omicron, there is no loss of taste and smell. If the patient comes to me with loss of taste and smell, it's most likely Delta or some of the other variant, not Omicron. In those cases, I would use it. I certainly have issued clear instructions in my hospital and my group of hospital that we should not be using it apart from these special circumstances. Now, yes, as a part of clinical discretion, there is something, Dr. Mehta, I call it the art of medicine, which every doctor practices. An art of medicine should be used at their discretion in the benefit of the patient. What happens, unfortunately, is that in India, we do not use that to the discretion. We just extend it to everybody. And that's what happened with the steroids and the tocilizumab in the second wave, and it led to mucormycosis. I am very firm on my thought process that mucormycosis was because of high blood glucose, because of indiscriminate use of steroids, not because of industrial oxygen or indiscriminate use of oxygen, but indiscriminate use of steroid, poor sugar control, and then knocked by tocilizumab on top of that. I think that sort of blunted the immunity, and the mucormycosis just came up. So we should not be. So my question to many of the doctor colleagues are the ones who are actually difficult. They keep on asking for monoclonal. So I asked them, would you take rituximab? It's one of the other monoclonal, just like that. And then they say no. And then I say, well, it is casirivimab and indivimab. It's the same biological agents. Why are you wanting to take unnecessary biological agent?
On a note to that, on a corollary to that, what is the side effect of the antibody cocktail? In case if somebody, just for reducing the anxiety in any person.
So there is no known side effect. Let's be very honest.
Correct.
I've had 2 patients who've developed some shivering and hypertension while the infusion was going on. Short-lived again. You just slow down the rate of infusion and it settles down. There is no side effect. I don't know whether there will be a side effect in 5 years though. There is no long-term effect which we know of. Okay, these are all biological agents. But as of the company's production and stuff, it should not cause anything. And we trust that, and we've used it for hundreds of patients now who deserved it. I am very clear about it, and I would still use it for patients who deserve it. Even though I know that in Omicron it may not work, but if I have a benefit of doubt to be given to a patient, I would use it.
You touched a very, very important subject in life. Now comes the mRNA vaccine and the amount of noise which it created. We don't know what's going to be happening and whether your DNA, RNA is going to be affected and what is going to be happening to the children. Now tell me, Rahul, the commonest question everybody is asking is, and I have people who have had COVID in the past, took 2 vaccines, got COVID again. what is this vaccination? How good has it been that, you took vaccines, you're thinking that you're not going to get it. When we were young, we took the measles vaccine, the polio and DPT and everything. It never came and touched us. Polio eliminated in the world because of the vaccine. But taking two vaccines, and what now in the next corollary will be booster. So tell me, why is the vaccine not really working, or is it working because we are not getting too many intensive cases? Go ahead, your views on the vaccine.
So vaccine was never meant to be given for avoiding infection. No RNA virus vaccine has ever worked to avoid infection. That's why we've not been able to eradicate flu. Americans and Britishers and all Western countries take their flu shot with a lot of pride every winter before the winter comes in. Why? Because it's RNA-based virus. They have to take it every year. So it does not give you sterilizing immunity. Even after taking a flu shot, what do they say? They say that you may get a flu, but the severity will be very, very mild, and you will not land up in a hospital. That's exactly what the scientists told us. You take this vaccine, please. You may get an infection, but the severity will be very, very mild. What all of us thought, this vaccine is there to eradicate the whole disease from the planet. That's not what's going to happen. It's an RNA-based virus. For a DNA-based virus, yes, you will get quickly sterilizing immunity possibly, but not for these RNA, and especially for coronaviruses, they're very difficult to eradicate out. So you will have to live to coexist with the virus. One fine day, it will disappear, like H1N1 just went away and it's now only sporadic cases. Same thing will happen. Okay, so I think we need to be very clear that virus was never meant to do it that way. Secondly, you mentioned about mRNA vaccines and the vector-borne vaccines and the other dead virus vaccines which are there. I think all of them provide us with a reasonable amount of immunity against severe disease. So vaccination definitely works. I have no doubt about that. But it was never meant to give us a sterilizing immunity. There is a ray at the end of the tunnel, though, light at the end of the tunnel, though. And that is, if we can get a vaccine which will provide us mucosal immunity, and the nasal vaccine which is coming out may provide us a mucosal immunity, which will then bar the entry of the virus into our body, because that's where it enters from, and perhaps give us a little bit closer to a sterilizing immunity. So these are my thoughts on the vaccine. Vaccines should be taken. They were never meant to give you no infection. They were always meant to protect you from severe infection.
True, Rahul. Now, the role of getting your antibodies done, should you be looking at what antibody count? Is that any kind of value by which you can say that you're not going to be getting your infection or getting reinfected again? Is there something that you can shed your light on antibodies count?
So there are various types of antibodies, out of which the most important one is the T cell memory, which is unfortunately not measured anywhere. So we really don't know how your T cells, which are your protector cells, are going to actually react when they are faced with an infection. Whereas the IgG antibody, IgM antibody, spike protein antibodies, they do tell us about some antibody level, but they do not tell you about how protected you are. I have today, so Omicron, of course, is a different beast altogether. But I have today a person with 80,000 antibodies who is infected. I have a person who's got 5,000 antibodies who is infected. I've got a person who has 0 antibodies who is infected. So immune escape is very much there. What is virus trying to do? Let's understand what the virus did this time. We created vaccines. All of these vaccines were meant to act on the spike protein of the virus. Where did the mutations happen? On the spike proteins. The mutation, 32 mutations happen on the spike protein, to the fact that it now has a virus escape, immune escape phenomena, and it has an escape phenomena from monoclonal antibody as well. So virus is trying to live. We are trying to sort of short-live, make its life shorter. It's trying to sort of challenge us and say that I am going to mutate to a point where you will have to start all over again. So that's what's happening.
Okay, so now the idea of booster, when there is arbitrary count, 90 days from this or XYZ. My idea was that when my antibody count goes down is the time I should be taking my booster. What would you throw your light on?
Of course. So that makes scientific sense. What do we have in our hand? We need to understand that when would the antibody level start going down? We knew that 6 to 7 months down the track, most of the antibodies disappeared from the vaccine. The natural antibodies probably stayed for a longer time, but the vaccine-induced antibodies disappeared. We all should have got a booster at around 6 to 7 months' time. There is no second doubt about that. However, we are not in a perfect world. We are not in a place where we have a very small population. We have a big population. So various reasons led to booster doses being rolled out in the month of January. Now, yes, since yesterday. So I think booster doses are important. Booster dose should be taken on time, and booster dose is going to bump up our immunity. Again, just because your antibodies are low does not mean that the booster will not boost it up, because your T cell memory is still going to be recognizing some amount of immune response. Your immunity will reset itself and will give you protection. So please go ahead, healthcare workers and the privileged people we are, healthcare workers and the elderly and comorbid people, please go and take your immunization now. It is the time for you to protect yourself, because very shortly you will have the other people who are in the other age brackets, and other disease processes will also start getting their booster doses rolled out in the coming months.
What about thromboembolism with respect to the booster doses? Is there something that you...
So there is something called as the VIT, the vaccine-induced thrombosis and thrombocytosis. It is a true phenomena. Again, let me just there are people who have this very big fear of thrombosis. Let me just give this as a corollary for people to understand. I am not trying to make any statement here, but most doctors would be happy to prescribe OC pill to a woman for whatever reason, contraception, cycle generation and stuff, where the incidence of DVT is around 20 per 100,000. And here we are looking at 1 per million. So that's the difference. We were happy to take a risk of 20 per 100,000, and here it is 1 per million. And I can tell you the reason why this noise is made. As long as it was confined to the fairer sex, 10 to 15 per 100,000, no men created a problem. Now it's equal. Men and women have equal chance of getting a thrombosis. So all the men are creating a problem that I will get a thrombosis. That's the only problem it is. If it was not that, it would not have happened.
So do you recommend taking aspirin or?
I don't recommend taking aspirin. You can take a paracetamol if you have fever. That is all we should take, and plenty of hydration so that you keep yourself healthy and well hydrated. That's all.
Right. Cross vaccination. The other question that is going to be asked is, a lot of fortunate few.
It should have been done, but you should have had data to sort of support it. Unfortunately, the academia in India, and I'm talking about us, Dr. Mehta, we are a part of the academia, actually did not do any studies to see whether Covaxin versus Covishield worked or not. So the only data we have is mRNA vaccine versus Covishield, which has been done in the countries outside India. We know that combination has worked well. So probably if you would have had mRNA vaccine available in India, we should have probably used those. But because we don't have, I think the paucity of data then makes it easier for decision making, because then you should take the same vaccine which was given to you before, because that's the safest thing to do. We don't know whether it will actually make a difference or not for you.
So there are a lot of patients of mine, they keep going abroad. So some have gone to Dubai, some have gone to the CVS in the US, right from New York to San Francisco. They have gone ahead and taken in CVS shots from the Pfizer vaccine. And they have still, so friends, let me tell you, they have also landed up with COVID. So there is nothing like the ultimate thing that you have by Hanuman, that this is going to work for you. There is no Himalayan mountain that is going to be worked. So all vaccines are equally, if not more or less, similar. You may still get it, as Rahul was explaining to you. Mix and match, there is no real study to tell us that this you can mix and match. What is available is way better than not taking it, is the clear message that Rahul is trying to tell us. You rather take it than not take it. And mix and match, your choice. Doesn't matter if you're taken and you've gone abroad and you've taken 4. I have young kids who have taken 2 vaccines here. Young is 25 to 30, 2 vaccines here and 2 in the US, and still could manage to get infection. So let's not have any false sense of perception that since the Moderna and the Pfizer vaccine is not available in India, we are at a loss or something. Not really. We are equally placed and well placed to see that the whole mirage that we have, that this was better than this, is wrong. We have been saved because of the vaccine so far from heavy hospitalization and huge kind of healthcare scarcity, which could have been really there, what we saw in the last April or so in the country. And that's because a lot of people have been immunized, and we've been fortunate to be in a country where we have made it ourselves. So Rahul, thanks for that. It was a very important message that you must be taking your booster without question. And the third booster, we will need another booster. After a third booster, who knows? Yeah, why not? By the same logic, just as the flu vaccine has to be given every year, you will need. What is your answer on that, Rahul?
Yeah, you probably would require it. It might become a yearly vaccine shot, or it might become a twice a year vaccine shot. We need to wait and see. The second generation vaccines are just coming out now. Many of the companies are producing second generations. What does second generation mean? That the first vaccines which were made were from the primarily ancestral strain, which is the first strain, the Wuhan strain, which came out. So second generation are the ones which are going to get corrected for the strain. And we will have those vaccines. And as days go by, as more and more research happens, we will come to understand whether we require another dose or not. Probably yes, is what my guess is. And how quickly or how soon, we don't know that.
With respect to mask, that N95, the good old controversy. Well, N95, no question, is one of the best masks to use. As close to safety as possible, and the right way. If you are comfortable, that means you are not wearing the mask the right way. If you are finding it difficult to breathe, and if you're uncomfortable, you wore the mask the right way.
Yes.
And sorry, go ahead, Rahul. You were saying something.
Yes. I just said yes.
Yeah. And with respect to a double mask, you can wear a surgical mask underneath and an N95 together with that. Any recommendation on double masking, Rahul?
Yeah. So I think people who are not non-frontline workers, non-frontline people, should wear 2 surgical masks. That should be the norm now. If you are not able to afford, because we need to be very practical in our country, at least 1 surgical and 1 cloth mask. That is the bare minimum that one should do right now. A cloth mask has to be a 3-ply mask, and a surgical mask has to be a 3-ply surgical mask. They are available for 1 rupee, 2 rupees, and please use them when you're stepping out of the house. For all frontline workers, which is not just people who work in the hospital, people who may be a bus conductor, a person who may be a bank employee, person who may be sitting on a railway ticket counter. They're all frontliners, because hundreds of people are interacting with you every day. You have to wear an N95 mask. An N95 mask, as Dr. Mehta said, should be worn in such a way that it is very tight fitting and makes you feel slightly uncomfortable. But that's the way it has to be worn. If you are going to be coming across a lot of people's contact, you wear a surgical mask above that N95 mask. That surgical mask is not going to protect you from any further transmission, but it's actually going to protect your N95 mask from getting soiled. So that's why you need to wear that. Because if I am in the ICU, and when I go in the ICU, I wear my N95 mask and a surgical mask on top of that. Suppose a drop of blood spills up and falls on my mask, there is no way I can remove my N95 mask in the ICU. So all I do is I remove the surgical mask on the top and wear a new surgical mask on it. That way I am protecting my N95 mask. So please wear a surgical mask on top of your N95 mask if you are in the area where you are likely to contaminate your mask.
And then the $1 million question, Rahul: how often and how soon should you be changing your mask? A regular surgical mask and an N95 mask, because people keep wearing it. It's dirty, they eat it's not serving any purpose after some time. Would you tell them what has to be done? How often should you be discarding?
So if it is moist, it's of no use. If it is moist because you are talking, it's of no use. Even if you have worn it just 2 hours ago, it's gone. The protection is gone. The virus will crawl through it. It's not meant to be moist at all. If it is possible for you to change a mask every single day, you should do that. You should wear a new mask every single day at least. That's the bare minimum hygienic recommendation. If it is not affordable for you to wear a mask every single day, N95 mask, then wear what I said, at least a cloth mask or a surgical mask on top of that, and the N95 mask can be probably extended by another day or two, but not more than that. A day or two is maximum what you should keep a mask with. For a surgical mask, it's a use and throw mask. There is no point in coming home, preserving that mask, hanging it on a towel rack, and then wearing it next day. I think it's waste of time. Cloth mask, yes, they are meant to be reused, but they are meant to be washed every time. So if you are going to be somebody who believes only in cloth mask, which is not the right way to do, but then at least keep 5 or 6 masks with you, wash them every day, dry them up, and use a dried mask every time you step out, 2 masks every time you step out, and keep on changing it every 2-3 hours.
Rahul, there is a question by a friend. Someone has autoimmune disorder and has got COVID 6 days ago. Other than fever, symptoms still persist. How should one deal with MS and the same?
Okay. Other than fever, my symptoms still persist. Okay. I think if the fever is not there, and if it is an autoimmune disease, which the person might be taking up some autoimmune medicines as well, I think we need to be very cautious that the viral phase can actually prolong in these patients, and that's why we need to do some blood tests, make sure they may not mount a fever response. So just because fever is not there doesn't mean that we should be taking a guard off. Please do the CBC CRP dimer. CRP is a very good reflection. The CRP starts to rise, get yourself in a hospital, and probably you need to take remdesivir at that time. This person would be a candidate to give a benefit of doubt to have monoclonal antibody. So the benefit of doubt is exactly for people like them who have autoimmune disorders and who are on immunosuppressive therapy, because naturally their immunity is blunted, and further immunity gets blunted because of the medicines which we doctors give. So I think they are the ones who should get a monoclonal antibody regardless of what strain it is. It may or may not benefit them.
Thanks, Rahul. A very practical question. Exposed to COVID positive person 2 days ago, asymptomatic, scheduled for my booster dose tomorrow. Do I go ahead?
No. Simple as that. Wait for 5 days. It all depends on what a person is saying exposed. Just because a COVID positive person went from near you does not mean that you were exposed. So if you were in that contact with the person for, say, at least 10 or 15 minutes, and one of you was not masked at a particular time in that 10 or 15 minutes, then you're definitely exposed. If both of you are not masked for even 5 minutes, then you're definitely exposed. But if both of you were masked and you just had a very casual 1 or 2 minute interaction and you walked away, then you are not exposed. By all means, go ahead and take your booster dose. But if you really think you are exposed the way I described, then wait for 5th day. Make sure that you don't have symptoms and then go ahead with your vaccination.
Yeah, very, very important point that he has mentioned. Friends, Rahul has given us a lot of insight into the whole subject. One of the things that I recommend for people to be keeping good cross ventilation. Keep windows in 2 areas open. Let air flow, even if your air conditioning is on. A closed room circulating the same air again and again with your indoor unit inside out, and there is no fresh exchange of air, is one of the most highest contaminated area that you could be breathing there in. So have fresh air coming in always at any given point of time. And the message very clearly given by Dr. Rahul Pandit at the end of the day is simple. This is a good variant, a user-friendly variant. We don't know whether another dangerous one is on its way. But as of today, we are quite safe. The Delta variant is almost gone. Every case that we see is, unless it proved otherwise, a Omicron. Your CF values which are there, which have been said, between 10 to 20 means you have a high virus load. Don't worry about it. See or check your symptoms, see what you are doing, when to do and what test to do. Well, you could be doing your CBC, CRP, and D-dimer. If you think that you are positive, if your antigen is adequate, you do not need to do your RT-PCR. If your antigen is positive, you are positive. Take it for granted. Isolating yourself is different from quarantining yourself. If you think you are exposed, you will be quarantining yourself. If you are having and suffering, then you are going to isolate yourself for a minimum of 7 days, or at least 2 days after you become asymptomatic. Taking your vaccines is your best bet right now, and a booster at the correct time is a great idea. Amount of hospitalization has reduced. Be careful. Next 2 to 3 weeks are going to be very crucial because the graph is going to go up, not really down. We are not plateauing at any given point of time. Herd immunity will set in. It's a question of time, but that might just help us. Rahul, is there anything else you would like to sum up of our today's understanding of the subject?
No, I think you've actually summed up quite nicely. And if there's anything, you or your viewers can get in touch with us anytime. We are there to help you out. Absolutely no problems. 24/7. If you have any questions, doubt, just text us. We'll be happy to help you out. No problems.
Rahul, if you can pass me your numbers, I will forward it to people. Nobody will bother you. But if there are queries and all, if you pass your email and your assistant's number, I'll circulate to people so that they can always come back and ask questions.
Sure.
Thanks very much, Dr. Rahul, for sparing your valuable time and giving us a great insight. A man on the forefront with the PPE suit, having had COVID in the worst time when COVID was not really understood. He has gone through it. He knows the pain. He has been able to help so many people around. He's in the task force. He knows what he's saying. Every word that he has said, you might want to repeat and understand every word he said. There is a lot of depth in what he has said. He has been able to convey the exact status with respect to the government, with respect to the common man, how we should be behaving, what we should be doing, how can we take it further. Well, great. Thanks very much for watching this show.
Thank
and
you.
Hope you had a great time. And we had a great time, Rahul. Thanks so much for being with us.
Thank you very much, Dr. Mehta. It was great to be here with you and interacting with you. Lovely.
Thank you. Thank you. Navneet, thank you for being there always and being there, providing us the backhand support. Come in front. Would like to appreciate your help. And Pooja, thanks very much for always being the great backbone and support for the show. Thanks, everyone. Have a great, safe weekend.
Thank you very much, sir. Thank you.
Thank you. Bye-bye.
Have a great, safe time. And as I said, I'll send you the numbers, contact number for Dr. Rahul Pandit. He's a great person, always ready to help anytime, and the helpline numbers. Feel free to contact. We'll have something more if something else comes up. As of now, stay safe, stay happy, stay healthy. Bye for now.
Bye-bye.
Bye. Thank you.